Do you want to know what immediately indicates a bad hair transplant? Of course, the hairline itself. Too simple, too low, and too even, and the whole face looks artificial. And now I will tell you how to do it right. Look at anyone who has never had a hair problem. His hairline is not straight. It is not perfectly symmetrical. It has slight irregularities and often a small gap of half a centimeter inward. The face of a person is not symmetrical, and the hairline shouldn't be either. When the doctor draws it with a ruler, symmetrically, perfectly straight, the effect looks painted. It can be seen from the other end of the room. A good hairline should look as if no one has interfered with it, as if it has simply always been that way. When someone looks at you and doesn't think about your hair at all, it means the doctor did good job. There is the entire architecture in this, which patients often do not know about. At the very front edge, we implant follicles with 2 or 1 hair, depending on what we have and whether the hairs are thin or thick. This is done to create a soft, gentle transition between the forehead and the hair. There should be no sharp contrast. There is skin on the forehead, then single hairs, and then it gets denser. Behind that first line, there are follicles with a greater number of hairs. Here we build density and coverage, but the front itself must be subtle because that is what people look at first. And each follicle must be implanted at the correct angle and in the correct direction. In nature, hair does not grow perpendicular to the head like a brush. It grows at various angles, slightly to the sides, forward. The doctor must follow the natural angle and direction of the patient's hair growth, follicle by follicle, manually. There is one more thing to keep in mind: age. If you are 25 years old and have extensive hair loss, you definitely dream of having the same hairline as in the past. Restoring such a hairline is usually a mistake. You will no longer be 18 years old, so you shouldn't have a youthful hairline. It is essential to plan a line that will look good in 10 or 15 years because your face will change. The line that looks perfect today may appear unnaturally low in a decade. A good doctor plans the hairline not for today. He plans it for the next 20 years. And small advice: before you decide on the procedure, ask the doctor for photos of his patients. Not just one, not just two. Ask for close-up photos of the hairline, because anyone with experience can create density at the top of the head. But natural hairline? That's an art, and you can immediately see who has mastered it. The natural hairline is not a straight line. It consists of subtle irregularities, appropriate angles, gradual thickening, and planning for years ahead. In a word, it is not drawing, but designing with the future in mind. Thank you for participating in this lesson. I invite you to all the upcoming ones.